You're in the middle of an intimate moment when suddenly the erection fades. It's a frustrating experience, and it can have a real impact on your confidence and relationship. But the good news is, understanding why this happens is the first step toward overcoming it. I'm Dr. Lais Costa, a urologist, and in today's video, I'm going to explain exactly what's happening when this occurs, and more importantly, how you can address it. There are several factors at play, including stress, health conditions, and even the side effects of certain medications. By identifying the root cause, you can start taking steps to improve your performance and prevent this from becoming a recurring issue. With the right knowledge, you can regain your peace of mind and transform your intimate experiences for the better. So, if you're ready to learn more, make sure you're subscribed to the channel so you don't miss any of our tips on health and sexual education. And if you find today's topic useful, go ahead and leave a like and share your thoughts in the comments. If you can relate to this issue, drop a 1 in the comments, or a 0 if you still have questions. Your feedback helps us provide even better content that addresses your concerns. The human body operates like a well-oiled machine. Everything depends on the proper signals to keep things working smoothly. When it comes to erections, this process starts with sensory stimuli. Anything you see, hear, feel, or even smell. These triggers activate the brain, which acts like a control center, sending out orders to get the body ready. When everything works in harmony, the parasympathetic nervous system takes over. This system helps slow the body down, reduces stress, relaxes muscles, and directs blood flow to the right places, like the blood vessels in the penis. These vessels expand, allowing blood to flow freely, which creates and sustains an erection. But if anything disrupts this balance, like a negative thought or an external distraction, the process can come to a halt. That's why it's crucial not only to have the right stimuli, but also to be relaxed and free from distractions. When you're calm and focused, your body can respond naturally, allowing you to fully enjoy the experience. If you want to bring back the spark in your relationship and strengthen your connection, check out my digital book, Rediscovering Intimacy: Healthy Sexuality After 60. Inside, you'll find practical advice on overcoming common challenges, rekindling desire, and building a deeper emotional and physical connection. Find the link in the first pinned comment below and discover how small changes can make a huge difference in your love life. Now, let's dive a bit deeper into how the nervous system plays a crucial role in the process. Think of the nervous system as the electrical center that connects your brain to the rest of your body, ensuring everything functions in perfect sync. During sexual activity, the parasympathetic system is the main player. It kicks in when the body is relaxed, signaling the release of chemicals that help blood vessels in the penis dilate. This allows blood to fill the cavernous bodies, which creates the erection. But if the sympathetic system, responsible for stress and fight-or-flight responses, takes over, the opposite happens. Blood vessels constrict, redirecting blood to areas like your muscles and heart, preparing your body for action. In moments of anxiety or stress, even something as simple as an intrusive thought, like worrying about a financial issue, can trigger this response. When that happens, the parasympathetic system loses its effect, and the erection process may fail. So, being relaxed and in a comfortable environment is absolutely crucial for your nervous system to support, rather than sabotage your sexual performance. Psychological stress can be a major roadblock to healthy sexual activity. During intimacy, the brain needs to focus on the pleasurable sensations. But when stress or negative thoughts take over, the body's natural processes are disrupted. This is because stress activates the sympathetic nervous system, putting your body into a state of alertness and shutting down the parasympathetic system, which is responsible for relaxation and enabling an erection. External factors can also interfere. Imagine hearing an unexpected noise, like someone knocking on the door, or thinking about a past uncomfortable situation with an ex-partner. These moments can trigger emotional responses that distract from the present. In these cases, the mind starts to associate the past discomfort with the current moment, creating tension that blocks the natural flow of the body's response. Everyday stressors, like worrying about overdue bills, family conflicts, or grief, can add another layer of emotional strain. These issues don't even need to be mentioned aloud. They can subtly influence your ability to relax. Even if the initial stimuli was strong enough to spark arousal, stress can be an obstacle that prevents you from maintaining that response. So, mental health and the environment around you play a critical role in ensuring that stress doesn't interfere with your intimate moments. Chronic health conditions such as diabetes, hypertension, and erectile dysfunction, ED, can also directly affect your ability to maintain a healthy erection. Let's take diabetes, for example. The issue begins with damaged nerves and blood vessels. High blood glucose levels, if left uncontrolled, can damage the nerves responsible for sending signals from the brain to the penis. Additionally, blood vessels can become stiff, reducing blood flow, making it harder to achieve or maintain an erection. Hypertension, high blood pressure, causes similar problems. Over time, elevated blood pressure can damage and narrow blood vessels, which also affects the flow of blood to the penis. Even if the stimuli are there, these conditions make the body less efficient at maintaining an erection. Even more concerning, certain medications used to treat high blood pressure, especially diuretics, can reduce blood flow, which can further hinder erectile function. For men over 50, these conditions, especially when combined, can significantly increase the risk of erectile dysfunction. Proper management of diabetes, hypertension, and related conditions is essential to minimizing these impacts. Keeping blood glucose levels in check and maintaining healthy blood pressure can help preserve the integrity of your nerves and blood vessels, allowing your body to respond better when the time comes. Certain medications can also interfere with erectile function, even when the right stimuli are present. For instance, diuretics, which are often used to treat hypertension, help manage blood pressure, but can reduce the blood flow necessary for a strong erection. On top of that, these medications may also lower zinc levels in the body, which impacts testosterone production, one of the key hormones for sexual desire. Antidepressants and other psychiatric medications can also interfere with sexual function. While they regulate brain chemistry and emotions, they can sometimes block sexual stimuli, making it harder to achieve or maintain an erection. This can be especially frustrating for men who are already dealing with performance anxiety. Medications used for prostate issues, like 5-alpha reductase inhibitors, can also impact sexual health. These medications lower testosterone levels, which can reduce sexual desire and hinder the erectile response. If you're on any of these medications and experiencing issues, it's important to talk to your doctor. There may be alternatives or dosage adjustments that can balance your treatment with maintaining your sexual health. A conversation with your healthcare provider can help you find the right approach to managing both your condition and your quality of life. Medications like tadalafil, sildenafil, and other similar options can be a valuable tool for men dealing with erectile difficulties. These medications work as vasodilators, increasing blood flow to the penis and helping to achieve the rigidity necessary for sexual activity. However, to ensure their effectiveness and safety, it's essential to use them correctly and under the guidance of a healthcare provider. For continuous improvement, some men opt for a low daily dose, such as 5 milligrams of tadalafil. This approach keeps a steady level of the medication in the bloodstream, leading to more consistent performance. On the other hand, some men prefer to take the medication as needed, just before sexual activity. However, for this method to be effective, it's important to give the medication enough time to reach its peak effect. Self-medication or increasing the dose without professional approval is dangerous and should be avoided at all costs. Overuse can lead to serious side effects, like sudden drops in blood pressure and potential heart issues. It's also important to note that these medications only work effectively when sexual stimuli are present. In other words, simply taking the pill won't automatically lead to an erection. It needs to be combined with a relaxed and stimulating environment where the body can respond naturally to the experience. While medications like tadalafil and sildenafil can help, using them irresponsibly, by self-medicating or increasing doses, can do more harm than good. Many men, feeling pressure for quick results, may ignore medical advice and self-adjust their doses, thinking more is better. This is a risky move. These medications have a vasodilating effect, which, when taken in excess, can disrupt circulation and cause dangerous drops in blood pressure. Ironically, instead of improving erectile function, too much vasodilation can lead to reduced blood flow, making erectile dysfunction worse. Even more concerning is that improper use can mask underlying health problems, such as cardiovascular issues, which may require immediate medical attention. There are also common side effects, like headaches, dizziness, and nasal congestion, which are often more pronounced when doses are too high. In the worst-case scenario, excessive use can lead to severe cardiac complications. This is why it's so important to consult with a doctor who can tailor the treatment to your specific needs. Adjusting medication for erectile dysfunction is not a one-size-fits-all process. It's something that should always be done with medical supervision. Everyone's body reacts differently to medications, and factors like age, weight, health status, and existing conditions, like diabetes or hypertension, can significantly influence how well a treatment works. For some men, a standard starting dose of 5 milligrams of tadalafil might work perfectly fine. For others, adjustments might be necessary. A doctor will assess how well the medication is working and, if needed, make adjustments to the dosage or suggest a different approach. If you're taking other medications, like diuretics or antidepressants, it's especially important to have medical oversight to avoid any harmful interactions that could affect both your health and sexual performance. Your doctor can suggest alternative treatments or adjust dosages to minimize side effects and improve overall results. This personalized approach is key to ensuring the effectiveness of the medication while also safeguarding your health. With the right care, you can achieve the best possible outcomes for both your sexual health and overall well-being. Making specific lifestyle changes can have a direct and positive impact on the quality of your erection. One often overlooked factor is the quality of sleep. Poor sleep affects testosterone production and hormonal balance, both of which are crucial for sexual performance. Establishing a consistent sleep routine and creating a peaceful, quiet environment for rest can make a big difference. Adequate hydration is another key element. Dehydration can negatively impact blood circulation and energy levels, which can impair your body's ability to respond during intimate moments. Drinking enough water regularly supports the body's overall function, ensuring you feel energized and ready to perform. Incorporating relaxation techniques into your daily routine is also incredibly beneficial. Practices like diaphragmatic breathing or gentle stretching can help release muscle tension and activate the parasympathetic nervous system, which promotes relaxation and helps your body perform better when it matters most. Engaging in hobbies that bring you joy and mental relief, whether it's playing music, reading, or gardening, can also enhance your emotional well-being. When your body and mind are in sync, it creates a solid foundation for both physical and emotional intimacy. This harmony is reflected in your sexual performance, leading to a more satisfying and stable intimate life. Now that we've explored the factors that can lead to the loss of penile rigidity during sex, from emotional challenges like stress to health conditions such as diabetes and hypertension, I'd love to hear your thoughts. Which of these factors do you think has the biggest impact on your life or the life of someone you know? Share your experiences in the comments below. Your story could really help others who are going through similar challenges. If you found this information helpful, please give the video a thumbs up. Your support is essential in helping more men find valuable information like this and take charge of their sexual health. Be sure to check out other videos on the channel for more tips on male sexuality and health. There's always something new that could make a difference in your life. And if you haven't subscribed yet, now's the perfect time to join our community. By subscribing, you'll stay up to date with all the latest content, so you never miss out on important information. Take care, and I'll see you in the next video.